Hi all, welcome back. The next series that we're going to talk about, or next system that we're going to talk about, is this nervous system. Okay, so we've talked about bones, we've talked about muscles, and now we're going to talk about the nervous system and kind of the components of the nervous system. So let's jump into it. So first off, let's talk about some general characteristics of the nervous system. Then we'll go into some different clinical examples of how different things can happen with the nervous system. Simple things and maybe not super life-threatening like migraines to, life-threatening examples like MS or Parkinson's disease, etc. All right, so first off, a little bit about the nervous system's function. Okay, so it's a regulatory system, and we consider it kind of the end-all be-all of regulatory systems. It's what's it's what's going to control the majority of the other systems. Okay, so it sends and it receives information, and it thus will control the muscle system, the endocrine system. It controls much of homeostasis. Okay, and we'll kind of go through the different components of that as we progress. So first, you have a sensory portion of the nervous system. This is going to detect changes, and this could detect changes in chemistry within the body. So maybe you have not enough calcium, not enough sodium, potassium, things like that, not enough water. It could also detect outside sources, heat, touch, okay, cold. It can detect really any kind of sensory that you can think of. Vision, smell, hearing, taste. Okay, these are all sensory inputs that are going to be part of that nervous system. Okay, so detect the change first, and then integrate that as a signal to make a decision. So an integration process, sometimes this results in information being sent to the central nervous system, the brain. Sometimes it's not sent to the central nervous system. Instead, it stays more localized. And we'll talk about these two examples and how these work. Okay. After that sense or that signal has been sent, okay, it's processed and a new signal is sent, and often it will result in some kind of response. This could be a muscle response of movement. Okay, this could be a glandular response. Okay, this could be a response in thermal control. Like there's lots of ways at which responses can occur. Okay? And again, it's a big player in homeostasis, maintaining that normalized kind of environment within the body. And more so, what we often think about is this is the process that you're currently learning or currently using to learn material. You're currently using to memorize material, currently using to think about material in this class and all other classes and just your daily life. Okay, so you have a receptor that's going to send a signal. Okay? That signal will be integrated. Okay? A response will be sent. Okay? That response is sent to an effector. So you have a sensory receptor, an integration, and an effector. Okay? And that could be a motor output and movement, okay? All kinds of things. All right, so let's first start with the CNS, or the central nervous system. Okay, this is the brain and the spinal cord. Okay, and this is where a lot of individuals realize, Oh, if I pinch my finger, I send a signal to my brain. My brain says I pinched my finger, etc. Okay, and that's part of your nervous system. Okay? The other part of your nervous system, which a lot of individuals don't realize, is not every signal is sent to the central nervous system. Some are, okay? But some will stay within the peripheral nervous system. The peripheral is outside that central area, okay? And it often connects the body parts to the central nervous system. Okay, so it's a series of nerve fibers that are running from the spine and the cranium out to different regions. Okay, this could be different sensory material like pigment receptors for vision, okay, auditory receptors for hearing, taste buds, sensories like movement, salinity sensors, temperature sensors, all kinds of things. But they're going to occur away from the central nervous system. So they're the peripheral nervous system, or the PNS. And that can be divided into two kind of subdivisions, or two different processes. Is it an afferent sensory, okay, or is it an efferent, meaning it's motor? Okay, so motor meaning it's driving muscle, afferent meaning it's driving some kind of sensory, which could be glandular, could be uh, any of those others that I just mentioned, like pigment sensory, auditory sensory, um, these kind of things are afferent. And we'll come back and we'll look at it in a little bit. Okay. Afferent sensory division. So again, sensory receptors are going to perform that function. They detect change. Okay, so there is a homeostasis. There's a normal kind of status in your sensory receptors, and when there's alteration to that normal status, when it's pushed in one direction versus the other direction, okay, it's going to detect that change and send a signal. Okay? That signal will be sent to the central nervous system. Motor division, okay, these are going to perform a motor function. Okay? The effectors are the muscles. Okay? Also the glands outside of the nervous system. Okay? And we'll look at these glands in much more detail later on. Two main divisions of the motor division: somatic, okay, that's skeletal muscle, which we spent a lot of time talking about skeletal muscle, okay, and autonomic, which is involuntary commands of the viscera. Okay? So some are voluntary, which we talked about skeletal muscle being voluntary, so you can alter the movement of your muscles. And then autonomic means that this is controlled by internal sensory, okay? And you really have no control over it. And we'll get to kind of the differences between these and how the nerves work differently in both cases. Okay, so let's look at a diagram of this. Okay, so you have your CNS, your central nervous system, brain, spinal cord. Okay, and then off that brain spinal cord, you have cranial nerves, spinal nerves, okay, etc. And they're going to hook up to sensory receptors. Okay, you can have these sensory receptors all over. Okay, even in your muscles, you can have sensory receptors. Okay, in your glands, you can have sensory receptors. Okay, and they will sense a difference, a different signal, an alteration, etc. That's going to send a signal back to the central nervous system, which would then send a signal from the central nervous system to a region that needs to have an effect, which we call the effector region. Okay? And this might be movement of muscle. It might be dilation of the eyes, which is, moving a muscle, but we might change the muscle diameter or the contraction of the muscle so that we let more light into our eyes, right? Or less light in our eyes. Right? We may see a tilt of the head from the muscle so we can hear a little better, or maybe the noise is too deafening, and so you might see a tilt away. Okay? Other things that are autonomic, which we don't have control over, but sensories can change these, okay, is things like your cardiac muscle and your smooth muscle. Okay? So you can have increased heart rate due to vision, hearing. Okay, so some of these sensory receptors would send a signal that would increase your autonomic nervous system. Okay? And we'll look at some examples of these as we progress. So let's talk about one application that is probably fairly familiar for a lot of individuals, and that is migraines. Okay, and so the reason I bring up migraines is it's one of those clinical applications. It's one of those sources of concern, I guess, that numerous individuals will experience. Okay, so we can bring up all kinds of things. We can bring up MS, we can bring up Parkinson's, we can bring up all these other nervous either diseases or disorders, yet you may never know anyone with any of those. But migraines, most likely you'll have one in your lifetime. Okay? So about 12% of the US population is affected, okay, by migraines, and this changes. So the definition of a migraine, it is defined, but I think the severity and what occurs during the migraine is different for lots of different people. Okay, so signs of a migraine. Okay, of course, pounding head and extreme headache. Okay, I think everyone's had a headache by this point in your life. Okay, but the pounding head, that headache, often causing nausea. Okay, an aura. Okay, so a blurred vision or a change in your vision. Okay, extreme sensitivity to light or sound or both, and many people who just have what they would consider a normal headache would have signs like this. Okay? And there are ways at which this can be triggered. Okay? Bright lights, certain types of food, alcohol, caffeine, a lack of sleep. High altitude can do this, along with an altitude sickness. Stormy weather for some individuals can do this. So changes in atmospheric pressure, both from altitude or stormy weather, can adjust this and cause a migraine. Women are much more likely to have migraines than men, okay, because they can get it triggered by hormones, and often depends on the female, but often women will develop a migraine just prior to menstruation. Okay, and there's reasons for this. They can last 4 to 72 hours. Depends on the individual. Okay, that's just the range. But what's going on is you have a period of excitation. Okay, and that excitation is the result of increased blood flow to certain regions of your brain. Okay? And so all the nerves are being excited in certain regions at one time. Okay? And when that occurs, okay, you overstimulate those nerves, okay, to the point where after that excitation, you have a period of non-responsiveness. Okay, so the nerves are no longer firing in those regions. Okay? That stimulates pain sensation, okay, in those regions of the brain. Now, what triggers it? Again, all kinds of things can trigger that increase in blood flow to the brain. Okay? Sometimes it's, caffeine, alcohol. Okay? Sometimes it's maybe you're allergic to food. Okay? Sometimes it's just a lack of sleep, and then you stand up and you increase the blood flow to that region. There's a lot of ways at which can trigger migraines, and in fact, we are not entirely sure how that piece works because so many people are different in triggering a migraine. That being said, though, if you know that bright lights trigger migraines, okay, then you should, a lot of people will wear special glasses when driving, in case individuals are, using their high beams and that bright light could cause a migraine. If you know that certain types of food, certain maybe types of seasoning or something like that can cause a migraine, then you should avoid it. And so that's one of the best ways and first approach to avoid a migraine is identify the trigger and avoid it, if at all possible. Okay? So this is what your brain looks like, okay, normal, and this is what the activity would look like during or during a migraine. Okay, so after that kind of period of excitation, you would have this period where you have multiple regions in your brain that are excited, okay? And that seems to be the problem. That seems to be what's going on and what's causing the pain is that non-responsiveness that would follow. Okay, we know that there are some drugs that could potentially stop migraines from happening. So if you have chronic migraines, triptans would stop that migraine from happening because it decreases blood flow. Okay, so it constricts blood vessels. Okay, but that's extremely risky in certain individuals. Okay? You don't want to constrict blood vessels in individuals that might already have constriction to their blood vessels. Okay? Or maybe they already have high blood pressure. You don't want to constrict blood vessels any longer or any more than what they might already be. Maybe they have poor circulation. You don't want to constrict blood vessels. So there's lots of reasons why drugs may not be the answer for individuals. Okay? So if drugs aren't the answer, then sometimes transcranial magnets or magnetic stimulation has been used to work, especially in chronic migraines, where individuals they know, especially females who right before menstruation, they might know they're going to get a migraine, so they might be treated in this field or in this way, which an electrical field is used to cause the dilation of blood vessels. So less, or sorry, the constriction of blood and the movement of blood out of that region. Okay, so you can kind of target these. Now, they have mixed results on whether or not this works, but a magnetic field will change the pole of certain ions that are in that region, okay? And that can be either a positive pole or a negative pole, and that can be adjusted based on the need of the individual, whatever they find comfort with. And then, of course, we kind of already talked about Botox, or that toxin that's produced by a botulism bacteria. Remember, that tends to dilute the neurotransmitters. Okay, so it tends to block acetylcholine from being released, and so there is treatment to kind of lower that. If you block the acetylcholine to be released, you might still have excess blood flow, but you may not get those pain receptors, which are being triggered and causing the pounding and extreme headache.